Good morning. I'm Dr. Praveen, the Medical Director of Solace Health, India's first state-of-the-art non-clinical cancer support center nestled in the heart of Bangalore city, a clinician-led and clinician-driven initiative. Today morning, I'd like to talk to you about the need for a holistic approach to cancer care. The overwhelming cancer caseload across the globe and in India is a staggering and a scary statistic at that. I'll come to those figures in just a while. If there's one patient expectation that ought to be respected and considered sacrosanct, it's the need for an undivided attention and the much needed time during a patient consultation. Whilst they walk out of a clinical consultation, patients should have that tremendous satisfaction of having got many a doubt and anxiety off their chest. And it's imperative for doctors too to have the tremendous sense of satisfaction during a clinical setting. But I know, as a conscientious doctor, sadly, the ground reality leaves a lot to be desired. An effective patient-doctor communication, which lies at the very heart of a care or a treatment plan, has direct impact on patient outcomes and patient compliance for that matter. Sadly, cancer is at an inflection point. Every year in India, we get to see around 2 million new cancer cases. And against the backdrop of a workforce of 350 oncologists, that equates to one oncologist for every 3,000 new cancer cases per annum. Quite a staggering statistic, isn't that? Now, with a view towards providing a meaningful continuity of care, something that all of us as doctors aspire to, I believe that the time has now come and the time is right for a new breed of healthcare professionals in the allied specialties such as psychosocial therapy, onconutritionists, and the yoga practitioners dedicated to oncology care. There ought to be a seamless, complementary, and collaborative alliance between specialists based out of a hospital setting and the practitioners of allied specialties outside a hospital setting. Please remember, you don't have to navigate this cancer journey alone. We at Solace Health are with you right through. Being told you have cancer can be one of the greatest challenges of your time. It can be devastating and shocking in equal measure. It can create a flurry of emotions such as fear, despair, sadness, loss of control, vulnerability, and most importantly, feelings of helplessness. Both you and your loved ones, who I refer to as the caregivers, are equal stakeholders in this unwelcome imposition. Even as you and your loved ones come to terms with this devastating news, you're bound to endure a deluge of emotions. And therefore, it's imperative for you to know that there is no right or wrong way to react to this situation. Please be kind to yourself. You're not alone in this journey. However arduous and uphill it's bound to be. As a caregiver, with the enormity of the news sinking in, you too are bound to be stressed, overwhelmed, scared, carrying this life-altering weight on your shoulders. Please do not despair. There is hope. If you feel that you're not able to cope, please do seek professional help as and when you feel the need for it. With the recent advances in cancer care, the modern-day cancer armamentarium has several weapons in its quiver to fight this battle. And therefore, many a patient have beaten the odds, I'd like you to know, and quite squarely at that, thereby earning that much accomplished moniker of cancer warriors, not just survivors, but having won the battle to be called a cancer warrior. And that is a great accomplishment in itself. I believe that with the right information and guidance, you too can empower yourself. Empowering yourself with the right information and support is critical. You may have often heard the expressions, ignorance is bliss, and what you don't know can't hurt you. Well, let me reiterate to you today that these expressions have neither the place nor the justification in a cancer-based scenario. On the contrary, fear of the unknown, as experienced by most cancer patients, can be best encountered by empowering yourself with information that is factual, credible, and relevant. It is therefore imperative for you as a family collectively to educate yourselves on the road ahead. Being equipped with just the right facts about your cancer treatment is certainly half the battle won. I'd like you to be an active partner in your care plan by having detailed discussions with your care team about what to expect in your cancer care journey, ensuring you understand the pros and cons of your cancer treatment plan, and thereby making informed treatment decisions. And lastly, remembering to seek out professional help as regards psychosocial therapy and onconutrition or a yoga practitioner as and when you feel the need for it. Please be sure to discuss any information you glean outside the realm of a hospital setting, especially in today's age of information overload with all the myths and information that's available easily on the internet. There is a tremendous need for holistic and compassionate cancer support, and there is an ever-growing need for that. As a practicing surgeon, both in India and in the UK, I've always advocated the need to treat the mind, body, and soul in its totality and not in silos. Having to support someone with cancer can be extremely stressful and affect both your physical and mental health. Patients with a positive and optimistic frame of mind respond better to medication, have a better compliance with their treatment plan, and foster optimal healing. Therefore, I do believe that allied healthcare specialties have a prominent role to play in a cancer journey. While such cancer support services exist in the West, sadly, India lags far behind in this sphere. Research has shown that such a mutually beneficial association can pay rich dividends at that. We are proud to tell you that we are the only non-clinical cancer support center based in India, and all our protocols are evidence-based for the 3 parameters that we offer, such as psychosocial therapy, nutrition and diet, and lastly, yoga and wellness programs. The benefits of allied health services, I'd like you to know, are varied and multifold at that. Embarking on a cancer journey can be emotionally exhausting and physically draining. Research has effectively shown that up to 35% of cancer patients will need the services of a professional therapist, and that, in my opinion, is quite a high number. Emotional distress impairs the capacity for meaning and purpose. It erodes the quality of life whilst impairing and impacting the adherence to treatment. And most importantly, it does amplify the sensations of pain. I do believe that the 3 verticals that we have to offer at Solace Health have a great role to play with psychosocial treatment, especially for those patients who are isolating themselves, and the sense of loneliness that sets in can have a deleterious effect on their whole approach to the cancer journey. I believe by having an optimally balanced, personalized diet plan, a patient who's optimally nourished is best placed to tolerate the harsh side effects of chemotherapy, such as fatigue, weight loss, nausea, and invariably this does translate into better clinical outcomes. As regards yoga and wellness, research has consistently highlighted the beneficial effects of the yoga programs by maintaining energy levels, decreasing insomnia, and most importantly, improving the quality of life. It has been long recognized that the built environment is increasingly likely to influence people and the well-being. Having spent my formative years and well over 3 decades now in a hospital-based setting as a surgeon, I've often noted that it's mind over matter. Traditionally, the built environment of a hospital tends to have dark and dreary spaces, which I believe are anything but helpful for a patient's frame of mind. We're pleased to tell you that meticulous attention to detail has been paid to designing the Solace Health Center, which in my opinion is an oasis of tranquility and vitality. It serves the very purpose of what a healing space is meant to be, i.e., a stress reliever, a soothing balm, a place of rejuvenation, empowerment and healing, and most importantly, one that you can perhaps subscribe to as a home away from home. We'll look forward to welcoming you to experience the serene and calm ambience that we have to offer you at Solace Health. All our protocols at Solace Health are evidence-based. Now, an evidence-based protocol essentially is one that integrates the best available clinical research evidence with expertise and that is titrated to an individual's values and circumstances. So therefore, the cliche of one size fits all can never be applied to a cancer patient or the caregivers. Evidence-based protocols have consistently led to better patient outcomes. We're pleased to inform you that we have partnered with Maggie's, the world's largest network of non-clinical cancer support centers based out of the UK, which at the present point in time have about 27 centers. We at Solace Health are Maggie's only partner in India. And we take great pride in subscribing to their time-tested, evidence-based protocols for cancer in conjunction with the UK-based surgical protocols and cancer protocols that I subscribe to individually as a surgeon. The mere thought of a cancer treatment plan is bound to be unsettling and rattling at that. Yes, the whole cancer journey is an expensive one. So whilst I propagate the need for allied health services, I would like you to know that our services are appropriately priced and quite equitably placed, and they're bound not to be an additional burden for your expenses. However, as you look around for allied specialty services to meet your needs, please do bear in mind that it is critical for you to choose a qualified specialist who's trained in addressing this cancer-based situations. I sincerely hope you've enjoyed this short talk on the need for holistic approach to cancer care. Please feel free to reach out to us and give us your invaluable feedback. And I would like to welcome you, especially to come and visit us at our center and experience the ambience of a soothing place that I've just elaborated to you. Until next time, as I sign off, I'd like to wish you the very best of health. Please do take care and thank you.